Hey there. Today, I'm taking you inside the operating room to explore what actually happens during a C-section. Now, you've probably heard that C-sections are common, but behind each one is a carefully choreographed series of steps based on years of anatomical knowledge. Ready to scrub in? Let's break it down, layer by layer. First, not all C-sections are created equal. If it's planned, there's time to prep, to mark out the perfect incision. But when it's an emergency, speed is everything. That urgency changes how and where the scalpel goes in, but the basic anatomy? That always stays the same. Before any cutting happens, surgeons look for key landmarks. Think of the pubic symphysis, where the pelvic bones meet, and the acis on either side of the pelvis. These landmarks mean the incision is symmetrical, safe, and away from major vessels or nerves. It's precision from the start, even before the blade touches skin. The first cut? That's through the epidermis, the outermost skin layer. Next is the hypodermis, which is mostly fat, and where surgeons work to control bleeding. This step lays the groundwork for everything that comes after. Now, here's a big myth. Surgeons do not cut straight through the six-pack, your rectus abdominis muscles. Instead, these muscles are gently separated. Why? To keep core strength, speed up recovery, and reduce pain and hernia risk. Anatomy isn't just about knowing what's there, it's about respecting it. Underneath, you hit the rectus sheath, a tough, shiny layer made from tendons. Opening this is all about technique, balance, and setting the stage for a stable closure later. At the very center is the linea alba, a vertical band that's like nature's zipper. It's got no muscle, barely any blood supply, and it neatly divides the left from the right. Surgeons love this spot because it means less damage, less bleeding, and a cleaner surgery. Once inside the abdomen, you're in the peritoneal cavity, surrounded by intestines and the omentum. Think of it as the body's natural apron. No organs are taken out. Instead, they're gently nudged aside to make room for the uterus. Now the uterus is front and center, much bigger than usual thanks to pregnancy. Nearby, the intestines and ovaries are carefully protected. This is where you really see how pregnancy moves everything around. Next, a precise incision in the lower uterine segment. The amniotic sac is opened, and the baby is gently delivered. Moments later, the placenta follows, and the uterus starts to contract, which is critical for controlling bleeding. Time to close up. First, the uterus is stitched to restore its strength. Then, all those layers, the rectus sheath, linea alba, and skin, are closed in reverse. Everything goes back as close as possible to how it started. Pause for a second and think about the size of the uterus at 30 weeks. It can be up near the ribs by full term. That's human anatomy. Flexible, resilient, and pretty mind-blowing. So, a C-section isn't just an alternative to vaginal birth. It's a testament to anatomical understanding, surgical precision, and the wonders of reproduction. If you found this breakdown helpful, hit subscribe for more honest, evidence-based medical education. After all, knowledge is the best tool you've got, whether you're a future doctor, a parent, or just someone who's curious.